This is module number one, reviewing humanistic perspective. The patient that I'm using will be John. He was admitted to Friends Hospital for attempted suicide by hanging, suicide ideation, anxiety, and depression. John is a 14-year-old African American male who currently resides with his mother and grandmother. Upon completing his psychosocial assessment, John states that what triggered his suicide attempt, depression, and anxiety was that he is currently failing all of his classes. John was admitted in October of 2013, so it was only a month and a half into his semester. He recently entered high school at an academically challenging area private school. He states that he's attended the private school since middle school and he had always been an exceptional student. He states that now that he's in high school, the coursework is extremely challenging, and he states that he is concerned with losing his scholarship, wasting his mother's money, and being expelled. He states that his mom is a single mother and is concerned for her financially. So that you can see that his anxiety not only stems from failing academically, but also his mother's financial status. And he's afraid that she's wasting her money on his education for him to be failing. So that's a lot of pressure that he's putting on himself. According to the Solution Focused Therapy, SFT, and Humanistic Perspective, John is viewing himself as a poor student, a disappointment to himself and his mother. SFT and Humanistic Perspective looks to help the client focus on their strengths, uniqueness, personal growth through trials and tribulations, and learning to utilize available resources to help find solutions to the presenting problem. SFT would say that because John is solely focused on the problem of him not doing well in school, currently the worry is causing the depression, anxiety, and suicidal ideation. SFT will focus on his strengths and resources to meeting his goal. SFT will determine that John is healthy when he begins to look beyond failing as a student and begin to focus on his strengths as a student, remembering what made him successful in middle school and rebuilding on those strengths to cater to his current academic caseload or his current academic load. He will learn how to use his available resources to help him succeed, such as his teachers, possible tutor, seek help from his cohort, his mother if that is available for him, um, and also just remembering that he is a good student and that he's just dealing with a difficult transition at this time. In order to help John address his presenting problems, the following interventions were used during his stay at Friends Hospital. John was initially, after the psychosocial assessment is completed, the client or the patient and the social worker will meet to develop an individualized treatment plan. And what that plan will do is to address the presenting issues, which are the depression, suicidal ideation, anxiety, excuse me, and allow John to set up his own personal treatment goals. The standard intervention used within a hospital setting is as follows for John. John was placed on an antidepressant to help lift his depressed mood. John attended group therapy sessions at least 3 times daily. John met with the unit psychiatrist or nurse on a daily basis to follow up on the effectiveness of his medication and to determine his mood or to evaluate his mood. John would meet with me on a weekly basis for our weekly check-ins to assess his mood, treatment progress, and to review his treatment goals to determine if they were being met. Out of the 4 interventions provided to John, solution-focused therapy would encourage the use of his group therapy and individual therapy, in my opinion. In each setting, John will be able to identify his strengths, resources, supports, and also bounce ideas off of his peers on solutions for academic success and to help him focus on future success versus his past failures. In SFT, change occurs when John can be able to focus on solving his academic struggles versus fixating on them, which triggered his depression initially. Change also occurs when John realizes that, yes, he is a strong student, and with the use of his resources, he will excel again academically. Change also occurs when John begins to alter the negative perception of himself through his grades. My role as the clinician is to establish an alliance with John and allow him to focus his treatment. In addition, we will articulate the problems, and it will be solely based on John's ideals. We develop goals within the client's frame of reference. And while during each session that I meet with John, we will explore for exceptions. So in the instance that maybe a tutor is not available, because I believe he did say his school did not offer tutoring. So with that exception, we can begin to develop a strategy for looking at outside tutoring services. Also, if that's not feasible for his mother, because she is a single mother and he does attend a very expensive private school, he can also begin to utilize his teachers and his peers that maybe have a better grasp of the material. He can participate in task development, provide end of session feedback, and evaluate client progress. Well, John's role in his change would be to change his thinking patterns, to stop fixating on the negative issues and to solely focus on the habits that he needs to change regarding his schoolwork. So maybe whereas in middle school he may not have had to study, school topics may have were maybe easier for him to grasp without having to study hard. So he may want to look at, okay, now you might need to actually study and break everything down piece by piece. But these will be the way that I would set this up for John is to allow him to come to those conclusions on his own so that he can actually begin to see the habits that he needs to change and to start to develop better habits for himself so that he can become more successful as a student. In reviewing the material for the semester, solution-focused therapy, I would say would be similar to ego psychology in that you're mediating a change. So for solution-focused therapy, you're solely focusing on the solution to the presenting problem and not focusing on the problem itself. So you're looking to make a change in how you approach the issue by working on specific goals. So for example, for John, instead of fixating on I'm failing, he can begin to look at he could begin to look at ways of bettering his studying habits, and also, which is the most important thing because John is not currently doing this, utilizing his available resources. I think due to, and from talking to John, he's embarrassed at this point. So working with a teacher may have been frightening for him. So what solution focused therapy would do is to have John rethink that habit of allowing his embarrassment to overcome him, and to allow him to meet with his teachers to help him to create better study habits. Maybe meet with teacher in personal time to go over things that are not quite as clear during class time, and also by utilizing other his peers to help him to get a better grasp of the material, and helping John find that by bouncing ideas off of other students, that not only helps you clear up any confusion that you have, but it also confirms that you are grasping the material, which would be helpful for John and increase his confidence. With ego psychology, what that tends to do is it's a mediator between the id and the superego. So when the id is concentrating on what I want. And currently John wants to only focus on failing as a student, doesn't think that he's good enough. He is thinking of ways to harm himself because he feels that he's not good enough, that he's also discouraged. So what's not happening is within his superego, he's not utilizing his he's not utilizing his I'm sorry, I'm drawing a blank. He's not utilizing